Limpopo, Mpumalanga and KZN have reported cases of malaria. People with fever and flu-like illnesses are advised to report to the nearest health facility. Let's get some clarity now. We're joined by Sasekani Manzini, the Acting Premier of Mpumalanga. Acting Premier, a very good evening to you. Thank you so much for your time. Warnings of a significant surge in malaria cases. What have you encountered?
Good evening to you, Mpo, and to the viewers at home. Indeed, also in the province of Mpumalanga, we have seen a significant increase in terms of the numbers or compared to last year. Currently, we have recorded 585 cases compared to 400 during this time last year. And of course, of serious concern is Bushbuckridge, where we have recorded 238, and last year we had 24 cases. So indeed, we are watching closely these cases in the province, because we can see that maybe due to the rains and the floods that we experienced around May, and also even now there are still rain, it's affecting the malaria in the area of the low belt of Mpumalanga. So indeed we are concerned as a province, hence we are putting teams in place to go in the communities and do the testing and also giving treatment.
Malaria is indeed a treatable condition when discovered early. What are you finding to be the big challenges that you're dealing with as you try and communicate the messaging and the warning?
You are correct. Hence, those cases that we find, and maybe the cases that people end up losing their lives, are those people who present themselves late, because their symptoms of people, they don't take it serious. They feel that they can take medication while they are still at home. So, but you remember, when we launched our campaign this year, we met with our traditional practitioner in the province, because we understand that they also play an important role where our communities, they start by going to them. So hence we also educate them in terms of the symptoms, so that they are able to refer those cases as quickly as possible, so that our people can be treated. Because indeed you're correct that malaria is treated. So we don't want to see our people dying because of malaria, while we can treat in our facilities, even as far as dispatching teams to go to the community and test and treat at that level in terms of those minor cases that they'll get at the community level.
What are some of the trends that you've seen? I mean, you've mentioned the first point of call when someone is sick, consulting a traditional healer instead of going to the clinic and getting professional medical advice. What are some of the others that you've seen throughout the course? As now the numbers are definitely much higher and the danger is even larger.
Yes, we have seen that, like I'm saying, people, when they've got these symptoms which they believe are not serious according to them, and agreeing with the traditional practitioners that they do see most of the people coming to them with those symptoms. Hence, we are saying that the educational awareness campaign that we are making in our communities in terms of our team, so that they can be able to be identified, because most of the people, they feel like if you have a flu-like, if you have got a fever, they believe that they can get some treatment, and by delaying to present themselves to our facilities, it becomes a problem. Hence, we are saying we want to work with key stakeholders and also working with our traditional leaders at that area when they are having their own gathering, so that we come and educate them in the main of prevention measures, so that during this time they must know that they must close their windows, they must wear things that are long sleeved at night, they must make sure that they allow our spray operators that we have employed as a department to go to their homes and allow them to spray, because that on its own reduces the risk of malaria, being infected with malaria. So I think those awareness campaign and working with key stakeholders and our community health care workers that are working within the communities, that can assist us, because indeed if we are detected early, you can go to our nearest clinics and be treated.
How are you rolling out the spray detectors? Is there a schedule that the community is aware of? Perhaps give us some clarity on logistics.
We have targeted 739,000 structures, because you will understand that in Mpumalanga is within the low veld, we've got municipality of Mbombela, your Nkomazi, Bushbuckridge, and Tabachwe, where we in the main is at the border of your Mozambique and your Swaziland. And also this joint campaign that we are having with our nearest Mozambique and Eswatini, and also your Limpopo and your KZN. So hence, if you look at also Bushbuckridge is closer to your Limpopo, and also these other borders that we are having. So those joint campaign also, because you remember that mosquito does not have borders. So we must work together, because as much as you can do something in South Africa, if you're nearest countries, there's nothing that is done in terms of spraying. So these 400 teams that are there, we have targeted the 739 because we have counted all the households in the Lowveld in Ehlanzeni, where we are. It's one of these areas that was identified as at risk in terms of malaria.
And how are you finding the attitude of some of the residents? Are they allowing the operators to come in and indeed spray? Is it a matter of authenticity, checking that these are indeed the right people who are allocated to do this job?
So far, we are working with our ward councillors, and what we also do is that we try by all means to employ people that they know in those different wards, because by so doing, we are minimizing exactly what we are doing with the high level of crime in our country, also in Mpumalanga. So we try and make sure that within the wards, as we employ, we can't employ somebody that is coming from Komazi to go and work in Bushbuckridge, because that on its own, it will increase the risk. So, and also over and above that, as they go and work, ward councillors are working with us in terms of monitoring, so that these people are properly identified in terms of their uniform and also the equipment that they use to go into the different households and spray. So some people, was that myth where people were saying, no, this thing, it adds cockroaches in our household. But I think slowly our people are starting to understand and allowing those sprayers to come in and spray their different homes. So of course, with the assistance of the different key stakeholders that we're working with.
Is there a particular group that perhaps is more vulnerable than the others? Or perhaps, are you also looking at schools and interacting with schools to try and also spread the message?
Of course, in different communities, you will not necessarily go to schools per day, but when we have got our school health program, we include everything in terms of awareness. So during this time, of course, our school health teams, they also talk about malaria, especially in the municipality that I've indicated, Ehlanzeni, because it's during this time, that's when we also intensify our campaign in terms of making sure that we talk to the learners, because you are correct, learners, they can convey messages, because even if it's a primary school, they'll go back and say, there was this lady talking about malaria, and they're very quick to take home the message. So we work with the different teams. It doesn't matter whether you're a team of HIV and AIDS and whatsoever, because we have incorporated our services. As we go out and provide services, we are able to, during this time, also talk about malaria, so that our people can understand, especially in regard to preventing, then we're also making sure that they identify their symptoms so that they can present themselves to our local clinics.
Very well. Thank you so much, Acting Mpumalanga Premier Sasekani Manzini, giving us some insight there with the worrying number of malaria cases on the rise, of course, affecting Mpumalanga, KZN, and other areas.